Integrated Health and Wellbeing Council, I welcome all of you to another very pertinent health discussion. This discussion is brought to you by the IHW Council and supported by Roche. I'm your host, Dr. Behjat, and today we will be delving on the topic Navigating the Complexities of Multiple Sclerosis, Understanding, Managing, and Thriving. And to discuss about this very important health issue, I have with me Dr. Sudhir Kumar, who is the HOD and Senior Consultant, Neurology at Apollo Hospitals, Hyderabad. Welcome to the discussion, sir, and thanks for taking out time and joining us here today.
Thank you very much.
So in this comprehensive session, we will be shedding light on the intricate landscape of multiple sclerosis, which is a potentially disabling disease affecting the brain and the spinal cord. Our expert will delve on strategies to modify the disease course and effectively manage symptoms. So without further delay, we will just start the discussion. So coming to you, Dr. Sudhir, when we talk about how would you define the disease, when we talk about the clinical perspective to a person who is, undergoing those symptoms, how do you counsel those patients? What do you tell them? What is the impact and why this thing is happening, the autoimmune, thing related? How do you describe that to me?
Yeah, thank you. So basically the term multiple sclerosis, so the word multiple is because the person can have multiple episodes of neurological symptoms, and sclerosis refers to usually the brain pathology, what was seen earlier, and now we see that on the MRI also. And basically there are three things we need to understand in this disease. One is that it is autoimmune disease. So when we say autoimmune, the antibodies are formed within the person's own body, and those antibodies affect the nerves. So that is autoimmune. And then second thing, the term uses demyelination. So myelin is the covering of the nerve, like how we have insulation for the electric wires. So in this disease, the myelin gets damaged. And so that is the demyelinating illness. And the third term is the central nervous system. So it is a disease of central nervous system, of which there are three main parts. One is the optic nerve, which is the nerve for the vision. Second is the brain, and third is the spinal cord. So in this disease, a person can have involvement of one or more of these three parts. So when we deal with the patient can have symptoms pertaining to any of these three parts of the nervous system due to damage of the myelin, that is the covering of the nerve, and due to a process which is autoimmune in nature.
Basically, when we, like you have very rightly pointed out about how the major parts of the body that are affected, which was supposed to be my next question, because when we talk about the wide variability in symptoms, differing from one person to another, depending on the area that is affected. So when we talk about those, body's response, and of course, the symptoms are different for patients. But if we talk about the generalized symptoms, how would you, for a person who does not know what he's suffering from until he's diagnosed with that? So what are the early symptoms that you would, think are important to look for?
Yes. So as I mentioned, the symptoms can be due to involvement of the optic nerve, brain, or the spinal cord. Depending on which part is affected, the person can have different symptoms. So looking at the most common symptoms, what patients with multiple sclerosis can have, if it is optic nerve involvement, as expected, they'll have drop in the vision. So visual obscuration or blurring of vision or dimness of vision, which is often painless. So they may not have any pain. Suddenly they will notice that they are not able to see, either affecting one eye or sometimes both the eyes also. And this happens typically over hours to days, which is a very short and what is called acute onset presentation. So suddenly it starts all of a sudden. And then second thing is involvement of brain. So in that, the common things the person can have is one-sided weakness of the hand and leg, one-sided numbness of the hand or leg. Sometimes they will have imbalance while walking. So there are three common symptoms due to brain diseases. And thirdly, it is the spinal cord. So spinal cord can get affected in the neck area, the middle back area, or the lower back area. If it's the neck area, then the person can have weakness of both the arms and the legs. If it is lower down in the thorax level, then both legs can get affected. And below the level of the affection, they also have numbness in that part of the body. Bladder symptoms are common, so patients may have difficulty in holding urine, controlling urine, or even sometimes passing urine. And then men can have difficulty in erection. Erectile dysfunction can also happen. So these are some of the early symptoms with which the patients can present. And typically they come suddenly, and then the persons they'll come to the hospital usually with few days history. So it's not a very long term in the first presentation.
Yes, Dr. Sudhir, very comprehensively you have talked about how, different body parts being affected can have different impact on the body. When we talk about the, immune system's role in multiple sclerosis, and what do you think? I mean, is it something genetic, or what are the key risk factors if we talk about them? What would you.
Yes, it's a very important question, and many patients who are affected or their family members, they want to know, okay, why the person gets multiple sclerosis. What is the reason for this autoimmunity? So the first answer we always say is that the exact root cause is not known, but there are few factors which have been very well studied. So in that, as you mentioned, genetic factors play a role. So we have about say 5 to 10% of patients who have a family history, and it can run in the family. But majority of multiple sclerosis is not genetic or not inherited. So it is acquired autoimmunity. And in that, few things have been discussed. One is that remote viral infections. So somebody has had infections in the past. Normally, we know that the role of immunity is to fight off infections. When we get infected, our body produces antibodies to clear off those infective agents. But in this autoimmune disease, the immune system goes haywire. So the antibodies that are meant to protect us from infections actually starts harming our own tissues. So this is one such thing. So it could get triggered by remote infections, could be remote vaccinations, could be remote head injuries, and but as I said, the exact root cause is not known. But these are various hypotheses. Also, there have been studies on vitamin D deficiencies, vitamin B12 deficiencies, which have been linked with causing this. And as we go and further discuss, we know that it is more common in women, and that is true for not only this disease but all autoimmune diseases are generally more common in women. So again, the immune system between genders differ, and somehow the autoimmunity or the immune response, abnormal immune response, is more in the female gender. So there could be a role of hormones also. So few things have been implicated. But as I said, still the root cause needs to be identified. And maybe in the next few years, when a lot of research is going on, we'll get more clarity on this part.
Right, Dr. Sudhi. So before we go to the treatment part, some modalities to enhance the quality of life of the patient. But before we move there, when we talk about, the daily life of individuals, how that is impacted because of these, because in some cases it may lead to disability also. So how does that progress?
Yes, so in neurological diseases, we always talk about disability, and same thing is true about multiple sclerosis also. And the commonest disability they can have is vision. And as we know, vision is the most important thing for us, one of the most important, because unless we see, we cannot perform anything. So loss of vision, which can last for days to weeks if not treated in time. So that can be a disability. The second disability which many people face is the motor disability, because today we need to move. We all need to move, walk, run, climb stairs. So, sometimes in the mild disability, they may have difficulty just in walking fast or running. But if the disability is severe, even taking few steps from going from one room to next room or going to washroom or kitchen within the home itself, the walking can become difficult. And the third thing that can happen is ataxia, or what is called imbalance while walking. So they tend to lose balance while walking. And also this lack of control on the bladder and bowel functions, that can be disability, as well as it can be a problem, social issue also. And many people require catheterization and things like that, especially if the disease is when all what I'm talking about is in a person who doesn't get diagnosed and treated on time. So luckily for us, these kind of disabilities are not common in multiple sclerosis, but those who are not treated on time or those who have severe disease, some of them can develop this kind of disabilities.
Dr. Sudhir very rightly have talked about how the disease progression can lead to such kinds of disabilities. Now coming to the, because you said that those who do not get diagnosed early and get those treatment options on time. So coming to the treatment part, how would you describe it? Because there are a lot of myths associated. If we talk about, some say that is if allopathy does not have a treatment, you can go to some other traditional form of treatment, and so a lot of misinformation because awareness is not there on the disease. So what do you have to say about the treatment modalities and how you can enhance the quality of life of the patient?
Yes, and I think that's the most important question, because in any disease, we need to talk about the treatments. So just before I start treatment, I'll briefly talk about the diagnosis, because we need to confirm also. The clinical part is the most important, the symptoms which we have already discussed. And then the next important test is to do MRI, because to see this demyelinating lesions, which are also called as plaques, if we do MRI of the brain and spine, we can clearly see them. And then while doing the MRI, we also give injection and dye called as contrast. So those who have active disease, the contrast lesions will be enhancing in nature. So the MRI is the first line. Then some people also require what is called lumbar puncture, where a needle is inserted in the lower back to draw some fluid out. And we look for certain factors like oligoclonal bands, which suggest that the disease is active. So that is the first part. With this, we can diagnose. And also in the first visit, sometimes the multiple sclerosis can mimic some other conditions like infarcts or vasculitis due to lack of blood flow, other infections. So depending on the neurologist assessment, few additional tests may be required to rule out those conditions. So now that based on the symptoms and MRI and other tests, if we have confirmed multiple sclerosis, the question comes about treatment. So treatment, again, we can divide into two parts. One is the acute treatments. When the patient has come to us, what treatment we give in that part. And then as we discussed in the beginning, that patients can have multiple episodes. So once we treat the current episode of neurological symptoms, after a month or few months or years, they can get again one more recurrence of the symptoms. So we need treatments to prevent that. So in the acute phase, there is no debate and doubt. All patients receive 3 to 5 day course of steroid injections, which is standard, and that will be given. Now the question comes what to do next. So we have different agents which are also called as disease modifying agents or disease modifying treatments. They are also called as DMT. So DMTs we have today, they are very good options, multiple options available, and we use one of them. And then basically the question comes, what to choose. So many factors play a role in us deciding what agents to choose. So one is the patient's disease severity, the patient's age, the gender. Why we discuss gender is because it is a disease of younger people. And so basically in the age group of 20 to 40, they are the ones who get affected with disease. And we know that this is the age when, when people get married, they think of fertility, they think of pregnancy and conception. So that also plays a role. We always want to choose drugs, especially in women who are already married. The drugs that don't interfere much with the pregnancy and fertility, those drugs are preferred. Whereas in a male, such considerations may not arise. But fortunately, or we can say, but this disease is like less common. So almost 3 to 4 times more common in women than men. But men do have MS. It's not that they don't get. And also those who have already finished their children and their families, then the choices are different. So one is the gender, then whether they are planning pregnancy or not, disease severity, and the age group. So they are the factors which decide this choice of agents. And we have multiple agents, including we have injections, there are tablets also. So various agents are there, and then based on these factors, we decide to use one of them. But the important point is that we should choose the highly effective treatments. So there have been two approaches. In one, they say that choose something which is of lower efficacy. And if the patient does not do well, then choose the higher efficacy drugs. But now we know from the research that it is best to give the best medicines in the beginning, because once the person recruits new symptoms and gets disabled, then whatever medicines we give at that stage, it may not be effective. To put it in the figures, between the 20 to 40, that is the period when we have to give the best medications, because beyond 40, the disability may be already at the peak. And there is no point giving at that age something very effective. So that is called as inverted pyramid. So earlier we had the pyramid approach where you start with lower efficacy and go to the higher efficacy. Now we invert the pyramid, give the highly efficacious treatments in the beginning, and then, and not the other way around.
Dr. Sudhir. So when we talk about, treatment options, because the disease does have a different impact on every individual. So are personalized treatment options an important, play a significant role in the treatment journey of the patients? Like you've already talked about how, age of the patient, gender, the phase at which they are in their life, whether they're seeking parenthood, things like that do matter. But you think that an overall, personalized treatment option is one approach that works well here?
Yes, definitely. That is why we cannot give a general guideline saying that this is the drug and everyone with MS, multiple sclerosis should take this medicine. So it's not that way. So it's a very, very individualistic approach when it comes to disease modifying agents. So, as I mentioned, there are tablets. So some people may be comfortable taking tablets, but tablets means it is daily, either once or twice daily. Two options are there. And then we have injectables. So in that we have options of giving thrice weekly injections, once a week injections, once in a month injections, sometimes once in 6 months injections, sometimes even longer, once in a year also. So various options are available, and then the efficacy also. Some drugs are highly effective. So somebody, if I see a person with severe disease, so I may not want to give them lower efficacy drugs at that time. So then for that we have highly efficacious treatments, and luckily now all those medications are available in India. And then one more factor we need to discuss is the cost factor, because unfortunately the treatment for multiple sclerosis is not covered by insurance companies, and most of the patients need to afford from their own pocket. I know that some government or some state government agencies, they may fund it, but by and large they are not funded. So the highly efficacious treatments, some of them are costlier, and if the patient cannot afford, it is better to give them some treatment than to deny them treatment. So cost factor always plays a role in our country. So based on that, we make a choice, and as you mentioned, it is individualistic. So each person, the choice may differ depending on their preference and also the disease severity, and finally the affordability.
Dr. Sudhir, that was supposed to be my next question, because when we talk about the affordability of, those treatment options and accessibility is the larger part of the, because when we talk about, tier 2, tier 3 cities and rural sections, people are not even aware of the disease. So how would they seek those treatment options? And once, even when they are seeking the options, it might not be, something which is accessible or affordable by them. So of course that is an important issue. Coming to, when we talk about, you said personalized and, individualized treatment approaches, and so you think counseling plays a very, because when we talk about the multidisciplinary approach to, for better quality of life, you think counseling is a pivotal part of holistic well-being of that journey?
Definitely, counseling is important, because today in the era of internet, there is information overload. And immediately when the person has any disease or doubt, they go on the internet and start searching. And information overload also causes a lot of stress, anxiety, and problems, because there are all kinds of reports and from all over the world. Now, the multiple sclerosis, the way it is seen in the Western countries, it may not be same in India, and things like that. Luckily for us, we see less severe cases, but it doesn't mean that we don't see them. So basically, it is better to discuss with the doctor and the treating team rather than gather information from the internet and increase the anxiety levels. And for that, as you mentioned, counseling and talking is important, especially when the first it is diagnosed. The patients and the family, they have a lot of queries and doubts. So if we are not ready to answer all the queries, we can ask them to go back home, come back the next day or after 1 or 2 days with more questions. So that is the time when all the counseling needs to be done. So they need to be told what to expect and what not to expect. So they see 1 or 2 cases which are totally disabled and things like, and they think that I'm going to get wheelchair bound and things like that, which is like, less than 5% people go to that stage. So when 95% people don't go to that stage, why should the patient, be worried about that 5%? So that can be clarified only by counseling. And also that 5% possibly they may not have got the best treatment. Now, any disease, if we don't treat, whether it's a diabetes or hypertension, the same end result may happen. So that is the importance of counseling. And then many times the patients may not have mild symptoms. So they may also think, why should I take treatment? Somebody may say, okay, go somewhere else, go for this natural treatment, you'll get cured. And this disease does remain silent for several months. And then they'll get an attack. So I've seen people like that where they were wrongly advised by somebody, not to take treatment. And they did well for 6 months to 1 year, and then they came back with relapses. So that is the important point to highlight in the beginning. See, it's not that you're going to get symptoms every month or every 2 months. The gap can be 6 to 9 months. And then with each relapse, the amount of disability recruits, it keeps getting added up. So when you see them after 10 years, they may be more disabled than today compared to those who took treatment versus no treatment. So 10 years, it takes 10 to 20 years to see the difference. But by then, all the time is lost. So whatever we had the window to treat, that is gone. So all this should be explained on the day one or initial few days. And obviously, because we are experienced, we have seen people, we can give the right perspective. And there are many websites where we can ask them to look at for the right information rather than misleading information. And then if they have any other doubts from their side, nowadays we know that it is a disease of young people. So it is unfortunately marriage is an issue. So when the girls disclose this to the prospective groom's family, then there are issues, and we have actively played some role, in the matchmaking also, even though we are doctors. But sometimes we need to clarify the doubts from both the parties, because once they know that this is what we can expect, this is what we don't expect, so then both the parties can clarify their doubts and go for the marriage. Because in by and large, marriage and pregnancy is successful in women with MS. So these are the points we can only clarify if we give them chance to discuss and open up about these issues. And in a couple which are planning again family, again we need to discuss, because certain medicines are safe, certain are unsafe, and certain medicines need to be stopped before pregnancy. We can continue till the time they are planning conception, and 1 month before they can stop. Certain medicines are safe in the early stage of pregnancy, some are safe in the last trimester, things like that. But good thing about pregnancy and MS is that generally MS is not very active during the pregnancy. Somehow pregnancy protects the people, but still as soon as they deliver, the risk may again go up. So we should tell them to, after delivery again, we need to switch back to her usual medications. So these are things that can be clarified with counseling.
Right, Dr. Sudhir, that is good to know that, matchmaking has also been one of the expertise area where you've been working. But yes, because with diseases like this, where awareness is not there, that, social pressure and that lack of awareness, myths, misconceptions, in such situations, I'm sure that, in your practice, you must have seen patients dealing with these myths, and, you must have played an active role in clarifying those. Now, like you said about the treatment modalities, when we were discussing that, it's not that you take that treatment and you stop it for the rest of your life. You can have episodic, symptoms again and again. So in between, are there some lifestyle interventions or some, apart from medicines, any other things that you prescribe to the patient to ensure that, the quality of life is enhanced and it doesn't deteriorate?
Definitely, because in every disease, especially neurological disease, lifestyle interventions do play a major role. In coming back to multiple sclerosis, stress is one of the known triggers for relapses. So we always advise them to reduce the stressors, and stress can be usually from the job, finances, personal. So whatever can be done to minimize the stress, that is good. Sleep also plays a good role. So they should ensure 7 to 8 hours of sleep, and nothing better than physical activity, because neurological disease, here it's a disorder of mobility and motor disorder. So they have weakness. So structured strength training programs, walking, aerobic exercises, any form of exercise plays a big role in reducing the amount of disability. And one of the other things which we highlight is the heat, exposure to heat, because we know that heat is one of the triggers for relapses in multiple sclerosis. So taking hot water showers or going out in the scorching sunlight. So these things should be avoided by MS patients. And then vitamin D and B12 deficiencies we also highlighted. So little bit exposure to sunlight when it's not too hot is always good. And if the D is still low, then they can take supplements, vitamin D supplements. Same thing applies for B12 supplements also if it is low. And then few of the patients can also develop psychological symptoms because of the illness. and the discomfort they face. So depression, anxiety are common. So initially counseling, psychological support, and psychiatric support if it is required. Those things are very, very important. We need social workers to talk to them. So many things play a role in improving the overall quality of life. And then regarding food, there is nothing specific for MS, but definitely, the healthy food, what we say. So lowering of the carbohydrate, appropriate amounts of protein and fats, and nuts. So these are always healthy foods, which also applies for patients with multiple sclerosis. So they should go for that rather than going for high starchy, sugary foods or beverages, because they can get, because generally their mobility may be little less, so they are slightly more prone to get metabolic disorders like overweight, obesity, diabetes. So by cutting down on the carbs and having physically active life can delay those diseases also.
Dr. Sudhir, very nicely you have reviewed the, how lifestyle interventions can play a positive role. Now, coming to one last question that would be before we take your final takeaway for the patients as well as at a community level, because when we talk about multiple sclerosis, you think familial support and of course support at the societal level, because you touched upon that when we talked about how it is an hindrance for marriage, and especially because it happens in young people. So you think solidarity, support, caregiver support of family, all that is important in the in the holistic picture when we look at everything in the broader sense?
Yes, in this, the family support is the most important. So when somebody is not married, of course, the support of parents and siblings, mostly the parents play a big role. And then after marriage, the role of the spouse is the most important. We know that unfortunately, divorce rates are common both ways. If a woman, gets the disease or the man gets a disease, somehow the amount of tolerance and acceptance of disabled spouses is going down, which is not appropriate, because spouse is for life, and we always take a vow of whether in sickness or in health we'll be together. But the moment somebody gets MS, I have seen unfortunately many divorce cases. So this is where the counseling comes in, and support. And whereas I also know of many women and men who have got excellent support of their spouses, and they do much better. With the amount of disability also, they do fairly well. So role of family support is important. Similarly, caregiver also, one spouse cannot take the care, especially if the person is disabled for 24 hours. So there we need the caregiver also, because otherwise the family member will get burnt out. Taking care of a sick person for 24 hours is not easy, because they also need to sleep, eat, and do other things. So somebody who is little bit moderately or severely disabled, a caregiver also plays a role. And coming to the society as such, I feel that CMS fortunately is not such a common disease. So here the governments should play a role in at least subsidizing the treatment. See, government is willing to treat smoking and alcohol related diseases, because they cause lung cancer and various cancers and heart attacks and strokes, and even liver disease due to alcoholism. So, but that government is willing to pay for those treatments. But why not for MS, which is not due to any bad habits? It is not the person's fault as such. I think your audio is off, Doctor. So, and then yeah, so I think so that is where the governments can play a role. They can create some kind of fund for MS, which is and affects the young people who are breadwinners for their families.
Families.
So, and that is where, and maybe insurance companies also, see, they cover so many illnesses. It is not a pre-existing disease. So their exclusions are usually pre-existing diseases or something caused by, neglect like alcohol or smoking. MS is none of those things. So why should they not cover? So there are things where, they can think from the patient's perspective, from society's perspective, and, try to help these patients financially also.
Is very important. Yes, Dr. Sudhir, that was a very pertinent point that you have raised. Coming to the final part of the discussion, what advice would you give to young people who are experiencing multiple sclerosis? How can you what do you want to tell them through this
See,
media?
I want to tell that, forget the internet and what you see on the internet about MS. It is not true. So speak to real doctors. Like looking at me, I started seeing MS in 90s. Now we are in 2024. So almost 25 to 30 years I have seen patients with MS. and 90% of patients are doing well. When I say well, they are totally independent, doing their own work. They're highly employed in good jobs and doing very well in their family, personal, and they have got pregnant, they have nice children. So that is what happens to patients, not what you see on the internet, that somebody on wheelchair or somebody not doing well, depressed, crying, dementia, all those things. That is maybe less than 5% of cases. And second thing is, don't listen to somebody when they say don't take treatment. Treatment is a must. It will not get cured or treated without any medications. Lifestyle interventions should always play a role, but the doctor will advise medications, whether tablets or injections, please take them. So there are two things with that: early diagnosis, prompt treatment, and continuous treatment as per doctor's advice will keep you healthy, happy, fit, and also, disability free.
Dr. Sudhi, that was an insightful discussion, and yes, they should not go to internet for that dose of information, but they should keep following platforms where we are giving them information through experts like you. So on that note, I would call it a day, and thanks for being with us and for imparting us with such comprehensive knowledge and information around the disease. And I'm sure that our audience have gained valuable support and knowledge, which will go a long way in making them understand the resilience in the face of challenging neurological disorder, and will go a long way in enhancing their quality of life. Thanks for being with us. Thank you, Dr. Sudhir.
Thank you. Thank you. I enjoyed this interaction a lot. Thanks a lot.
Yes, it was very informative. Thank you. So that's all for today, everyone. We'll see you again in another important discussion. Till then, please follow our social media pages for more updated information on health. Thank you.